All right, I just wanted to update everyone. It's been 1.5 years since I had my stem cell injections at Regenexx Cayman Islands. I haven't had nearly the results that I was hoping for. There was some improvement, but not enough to feel better. So I am actually going back for another treatment pretty soon here to the same location, Regenexx Cayman. Here's my before photo of my MRI. You can see the 3 discs circled, the bottom L5S1 disc, the top T11T12 disc, and the second from the top T12L1 disc. Each of those discs was injected with 1 million stem cells. And then here's my new updated MRI. This was from 1 year post-injection. So you can see, again, that top disc, and then I'll kind of go back and forth here so you can compare the two, but to me it looks like very similar. The L5S1 disc looks the most similar to me. The T11T12, you can see the bulge to me looks a little bit better at the top disc there, out the right side. The T12L1 to me looks worse. And I'm very symptomatic, especially in that mid-back area. I have a lot of pain the last 6 months or so, more so than before then. So the appointment that I had with my stem cell doctor reviewing this second MRI, the one thing that he noted on a positive point of view was that the black circle around each disc, the annulus, looked darker in the imaging, which reflects that the annulus is stronger. So you want it stronger and more rigid so that when you go through movements and compress your discs, that the annulus will be strong enough to keep the inner disc material from bulging out. So that's positive, and you notice some improvement in the facet joints that were injected. So it wasn't the goal is to reduce the size of the disc bulge and then ultimately to seal the annular tear at the L5S1 level. And this is just another view of imaging of my lumbar spine. You can see the green circle just shows how hydrated the other discs in my lumbar spine are. If you look below the green circle, you can see my L5S1 disc, which is darker. The white means hydration and filled with fluid. So dehydration in your discs is bad. And then above the green circle, you can see the 2 discs up there, and the T12 vertebrae. You can see how it kind of connects to the levels above and below it. And then instead of being like a rectangular, they're supposed to be, you can see that actual vertebrae, the bone, is misshapen. It's wedge shaped, which is a part of my problem, which I believe has led to a lot of my disc issues in that region. Some of the circled areas here, you can see how there's like indents in the vertebrae where they're not straight across. Those are Schmorl nodes, which are discussed in my MRI imaging report, which I'll put at the end of the video if anybody's interested in reading that. But just thought this view would be interesting to look at. This is my upper thoracic MRI. So you can see the red circle is showing the T6T7 disc, which is one of the discs that was injected with 1 million stem cells. Didn't get a lot of imaging improvement from that. And then the green circle up top is just showing how much better my upper thoracic spine going into my neck. The vertebrae, you can see they look more rectangular, and the discs in between them look taller and more hydrated. So just to show that it's it's my mid to lower thoracic as well as my upper lumbar into the thoracic, and then my lowest part of the lumbar, which are the problems. But there's a few good spots included in my spine here. So this is just showing the before and after side by side. So you can see the left again is the before with the red, and the right side is the 1 year after. And this next photo here is just I just Googled normal imaging. So this one's a normal lumbar MRI. So you can see the vertebrae, how rectangular they are, the height of the discs in between them, and just comparing the 3 areas that I have circled compared to a normal standard lumbar MRI. And then I did the same with a thoracic MRI. So this here is just showing you on the Regenexx website. You can see, this is the hope. It shows the before on the left and the after on the right. You can see the bulge going away on these images, and this is, they injected platelet lysate into the epidural space behind the discs. And then the second photo from their website here is showing the annular tear. It's the HIZ, high intensity zone, where it shows up as that white mark, and then on the second one you'll see that it's gone, so that they injected the bone marrow stem cells into the disc, and that's how they got rid of the annular tear. So this is kind of the goal and what you're going for when you go into this procedure. So and it's everyone responds differently to different procedures. So even though this first round didn't work for me, it doesn't mean it wouldn't work for someone else who was in a similar situation. You can see the photos from their website showed good disc height, but bulges and annular tears, whereas my disc height was poor, so may not have had enough room to retract back into the normal disc space. So now I'm just going to show my MRI imaging report here, and I'll just leave it on this so you can take your time, view this if you need to pause it or zoom in, whatever. But it's just my latest imaging report. The conclusions are due to my multi-level disc height, degeneration, dehydration, and Schmorl nodes, multi-level Schmorl nodes. The radiologist believes that I have Scheuermann syndrome, which is it's like a genetic thing, and which would make sense since I've had this, chronic back pain for 20 plus years now, since 7th grade. So, and then the second part is just discussing how my T12L1 disc bulge is the most prominent finding out of all my disc protrusions. The up above, where it's discussing each level individually, it talks about how that level, the T12L1 disc, comes into contact with the tip of the conus, which is the spinal cord. So I think for me, I'm really hoping that this second procedure here can give me good results and reduce the size of that bulge. And if not, I would probably have to consider doing like a microdiscectomy or something, where they go in and it's a small surgery, but they would either carve off the back part of the disc, which is coming into contact with the nerves and the tip of the conus, or there's also one like a disc FX, where they can go in endoscopic the same way and then just suck out part of the inner discs, hoping that that bulge will retract back in. So there's small surgeries that you can try if that ends up being my only potential good option here. So hoping that this second one works out, and it'll discuss here, if you read through it, there's multi-level disc bulge, so you can read at each level. And on one of the levels, the radiologist accidentally put C6-7, which is supposed to be T for thoracic, but just an error there. So that was one of the areas that I got injected, and it still has that same 3 to 4 millimeter disc protrusion, which is flattening the cord. But overall, I just, for anybody that's watching and cares to follow this, I appreciate your well wishes, and I will keep trying to get better through this process. And anybody that's watching because they're going through something similar, I encourage you to, keep fighting and hang in there. There's a lot of regenerative medicine that's coming out, that's already out. That you can go to Cayman Islands, you can get stem cells. There's stem cells locally if you don't need cultured ones. And then there's new stuff coming out like Degeneration and Viadisc, and all kinds of different regenerative medicines on the way, as well as more and more minimally invasive surgeries. So appreciate everyone. Hope you're doing well. Thank you. Take care.